Welcome back. We are joined today by Dr. Afshin Skibba from Premier Surgical, and we're talking about your vascular health. This is so important as we move into the new year. Yes. Who's at risk?
Well, there are a number of risk factors. The most important risk factor is smoking. Believe it or not, smoking increases the risk of blood vessel blockage by over 400%. There are a number of other risk factors. People who have kidney trouble, that accelerates the risk of atherosclerosis, and a lot of very garden variety issues that many of us have, like high blood pressure, which is hypertension, dyslipidemia, which is trouble with cholesterol basically, and issues with diabetes control, hyperglycemia. All of those do contribute, and it's important to know that each of these risk factors are additive. So if, for example, someone has diabetes and high blood pressure and they also smoke, they're going to be much worse off than someone who just has high blood pressure. Okay, so let's talk treatment options for those who are more susceptible to these types of illnesses with the vascular disease section. What are some of our treatment options there? So it used to be, not that long ago, just a couple of decades, that we had to do major vascular reconstructions to fix all of these types of problems. And although we do occasionally have to still do that sometimes nowadays, most of our procedures can be done percutaneously. And what that means is it's just a needle stick directly through the skin into the blood vessel with no incisions whatsoever. Okay, I know you mentioned smoking just a moment ago, and that's obviously a risk factor. Yes. Are there other preventative measures we can take to steer clear of any of these issues? Yes, yes. Well, so just to clarify, nothing can undo the damage that has already occurred. Right. But really, it's just a matter of modifying those same risk factors that we mentioned. So if, for example, someone is a smoker and they can't control their diabetes very well, if they can quit smoking and have better control of their diabetes, then that goes a long way to prevent further issues down the road. Okay. Are there symptoms we might notice if we are having vascular issues? Yes. And it's all contingent upon the location where the blood vessel is. If it's one of the carotid arteries, people can have mini strokes in the belly. They can have belly pain after they eat, and the most common is where they have blockages in the legs, where they may be fine sitting around like we are, but once they're up moving around, they can get very severe cramping and pain in their calves. Okay, and obviously the sooner we check these things out or see a specialist, the better our outcome. Absolutely, absolutely. And we've got people available every day of the week to help out if we can. Okay, we will have all the information for you on our website. Thank you so much for all the information today. Appreciate you being here. Coming up here on the show.